So the evidence is a clinical trial which was conducted in Italy, when I worked in Italy, to be honest. And this trial was an observational, non-interventional study which involved a patient with chronic lymphocytic leukemia, either in first line or patient relapsed refractory disease, who were treated with Ibrutinib. So the first results were already published, and they showed really that in terms of efficacy and safety, results were very similar to those of clinical trials. We present here in this meeting, the International Workshop of CLL meeting, we present data of dose intensity. In other words, we try to correlate the adherence to the treatment with the clinical outcomes. It was interesting the fact that there were most patients, mainly elderly, a patient who were medically unfit. In these patients, there was a reduction of the dose, so the adherence was lower. However, most patients were able to retain about 80% adherence at 90 days. And what we found is that a cut time at 90 days was critical for assessing the impact of those adherence on the clinical outcome. So in other words, patients with high-risk disease, such as patients with TP53 mutation or patients with advanced clinical stage, in this patient, the respect of adherence was critical for achieving a very good clinical outcome in terms of progression-free survival. In contrast, in patients who were older or medically unfit, also limited adherence to the therapy did impact on the progression-free survival. So the general message is that at the end, a personalized therapy with Ibrutinib can be done when there are medical reasons that justify reduction of the dose.